Hello, I am Dr. Vivek Vardhan Veerapleni, a consultant pulmonologist at Shwasa Hospital, Narayanguda and Madhapur. Now, World Immunization Week is going on. World is celebrating World Immunization Week, predominantly focusing on children. I'm sure all the children that are born these days are getting vaccinated. Most of them, almost all of them, because there's a stringent immunization schedule that's been followed by all the government and private hospitals across India, across world. There's no problem with that. Everybody's getting vaccines. But adult vaccination, adult immunization is being neglected all over the world, especially in developing countries like India. Adult immunization means an adult who is healthy should take vaccines as well. But our mindset is usually if a person is healthy and normal, especially an adult from his 20s to 60s, then he'll be like, why should I take a vaccine? Why? Because I'm totally fine, I'm healthy. What is the point of taking a vaccine? That's a common question. So let me answer that. We have seen a recent COVID, we have seen recent flu and also flu pandemic in 2009 and also a lot of pandemics before or epidemics before. In all these epidemics or pandemics, a lot of lives lost were of adults and elderly. If they had a vaccine before, they would have been saved. However, COVID was a situation where nobody knew that's going to come. It was totally a bouncer. However, humanity has developed a vaccine within 1 year and we have seen the benefits of the vaccine. We could stop the COVID deaths right after the vaccination. Hardly we have seen any deaths in third wave, and also the COVID cases that are coming right now are just mild. Hopefully they'll stay that way. Flu. So flu vaccinations are extremely important. When you ask me what are the vaccinations available for adults, I'll list it out. Number one is influenza vaccination, flu vaccine, the quadrivalent influenza vaccine, where it covers 4 strains of influenza, including influenza A and influenza B. Second one is COVID vaccination, we all know about it. Number 3 is pneumococcal vaccination, where we have 2 different types of pneumococcal vaccines. The fourth one is diphtheria vaccine, which can be given in adults, especially in patients who have chronic lung diseases such as COPD, bronchiectasis and asthmas. Next one is herpes zoster virus vaccine, which is available of late in India. That is also very important. And so on and so forth. There are many other vaccines, probably around 10 for adults, which are supposed to be taken, few mandatory, few if you're traveling to particular areas. So these vaccinations are supposed to be taken by adult who touches 50 years of age as a rule. So flu vaccinations, pneumococcal vaccinations should be taken in more than 60-year-olds. However, in India, we can bring that down to 50 years because of a lot of dense population and also the developing nature of the country. 50 years, yes, without any disease, you can go ahead with these vaccinations, influenza and pneumococcal vaccination. Age is not a barrier when it comes to these particular problems that I'm going to list. If you have diabetes, if you have kidney diseases, lung diseases, cardiac problems, liver diseases, obesity, or if you are someone who is a traveler frequently, or if you are someone who is a healthcare provider, doctor or a nurse or a ward boy, whoever it is, so you are a candidate for vaccination no matter what your age is, be it 20 years, be it 40 years, be it 30 years, anybody more than 6 months can take flu vaccination. So children, yes, it is given in the hospitals, but adults is the problem. So this discussion is predominantly focusing on you, the adult, because we are the ones who usually neglect vaccination. So vaccination is very important. It is crucial to maintain good health. So it prevents a lot of admissions, it prevents hospitalizations, it prevents ICU care, and it prevents deaths. So vaccination is an intervention that is proven to prevent morbidity and mortality. So this is the reason why we are doing this video in this particular time of World Immunization Week, also to focus on adult immunization. Government of India doesn't have an adult immunization program yet. Hopefully it comes down in future. I know it's not easy, but maybe it is possible once the country is going towards the more development side. So I hope you learned a few points out of this video. Please share this, subscribe to our channel Allergy and Lung Talks for more validated information. Thank you.